to the cardiology clinic. Thank you for coming and seeing me today. I hope you're well. Yeah, definitely. We've got a few things we need to discuss, and I need to kind of assess your vitals, and I need to assess the kind of condition of your heart just now. Yeah, but first of all, we're just going to have a little chat, and we're going to work out what has been the issue, and I'm then going to do the assessment. Okay, so I just need to take some details first of all. So what's your name? Okay. And your address? Okay. And your date of birth? Okay. Now, are you on any other medications just now? Okay, how long have you been on the cholesterol tablets for? Okay, 2 years. Okay. Now, see when you're lying down at night, can you hear your heart? You feel it pulse through your ears, okay? I'm assuming you can feel it as well. Yep. Okay. There's nothing to worry about, just need to check. Yeah, so what about, you were saying, well, obviously you've been referred here. On the notes I've got is that you were feeling quite breathless when you were running. Yeah. Okay, so what kind of exercise were you doing? Okay, so you were doing jogging. Okay, and how quickly did it take for you to feel quite out of breath, more so than normal? Okay, a minute. So that's really not very long. And you get chest pains as well? Okay, and when do they start? Okay, so they also start around the 1 minute mark. And your pains, can you just tell me, where are they centred? Are they kind of around the left area? Are they across the whole chest? Are they down your arm? Okay, so they're across your whole chest. Okay, but the left side's a little bit more painful. Okay. How about in any other daily activities? Do you get pains other times? Okay. Again, that's sort of when you're kind of doing the exercises, so when you're picking your children up and things. Okay. Pop that down. Okay, now in terms of breathing, does your chest like tighten up? Is it more? No, so you feel breathless because, okay, of the pain. Okay, and do you ever take anything for the pain? Okay, so sometimes paracetamol. Okay. Yep, that's fine. Okay, have you got any history in your family of heart conditions at all? Okay. No? Oh, yeah, no, that's, yeah. When was that? Okay. Okay, so your great-grandpa had a heart attack. Okay. No, that's useful information, absolutely. Okay. And have you ever been tested before for heart conditions? No. Even since birth? No. Okay, that's fine. Alright, okay, so what I'm going to do first of all is I'm just going to have a little listen to your heart. Now I want you to just relax. That's it. Just relax, because otherwise you will increase your heart rate. So I'm going to start at the front and then I'll move around to the back. Okay. Okay. Okay, what I'm going to do is I'm going to now record your heart rate. I'm just going to time it and see how many beats per minute we're at. Okay. Okay. Yeah. Okay. I'm just going to note that one down. And I'm going to do it again. Okay. I'm just going to do it kind of round the back just now. Okay. And you feel like you can, yeah, is it just, are you a little bit anxious at all because you always feel like that? Okay, no, it's fine. We'll discuss your vitals after I've checked them all. That's fine. Okay. What I need to do now is I need to check your blood pressure. So this is it here. It's nothing to worry about. Okay. Okay. Yeah, so we're going to do this a few times to get the average. So can you pop your arm out for me? That's it. Okay. 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 We'll do that again in that arm. Okay. That's it. Okay. One more time on that arm. Ready? Okay, ready? Okay. Now we need to see your right arm. Okay. Okay, can you hold your right arm out for me? Thank you. That's it there. And here we go. Okay, ready? Okay. So right arm. Okay. Second time. Okay. And the final one. Ready? Okay. Okay. So that is us. Okay, so I'll just move this to the side. Okay. So your heart rate is particularly high for a resting heart rate. We need to work at getting that down. I think that's probably why you've been hearing it, but you've got quite high blood pressure as well. So I think that's why you've kind of been hearing that pulse when you're, at night, and the thumping. It's just your heart seems to be working a little bit more to kind of push out the blood. So I'm just going to show you what your heart looks like. So this is a drawing of your heart. there. And this is kind of plasticized images of the heart. And what I think is happening is the muscle around the base of your heart, so the apex, the muscle's a little bit bigger on your left ventricle because it has to pour, or it has to push out more blood than normal, or than your other side. And I think it's just struggling a little bit. The muscle's perhaps weakened, and we need to have further analysis of that. But for some reason it's not being able to push out the blood the way it should. Yeah. So sometimes that can be that there's a blockage. It might not just be that the muscle's weaker than it should be. It could be that there is a blockage, and we will have to investigate that. The next steps will be an ultrasound. So as you can see in those images there, I've got another image to show you of the heart. So as you can see, this bit here is what I'm referring to in this on the image. And I just think this part of the heart is just not quite functioning the way it should be. But it's not to worry. We will have you sorted in no time. So the next steps are that I'm going to write you a prescription for some, I don't know if I should give you, probably stick with the cholesterol that you're taking just now. Yeah, and we're going to give you some Ramipril for your blood pressure. Yeah, and I'm also going to give you some benzoflumethiside as well. So I'm going to give you, I'll start on Ramipril 5 milligrams. The lowest is 1.25, but I'm going to go for 5. And you're going to take that once a day. Please stick to the same times. If you're going to take it in the morning, take it in the morning every day. If you're going to take it at night, take it at night every day. But keep it at the same time because you want 24 hours between your pills. Absolutely, that's how it's most effective. And we'll also give you some benzoflumethiside, and that will be the 2.5 milligrams. And again, that's once daily. So you should probably take that at the same time as your Ramipril. Absolutely. Now, what we'll do is we'll schedule an ultrasound in for maybe 3 weeks, I think. Yeah, I've got an opportunity to do then, and I as a cardiologist will do that. It won't be a nurse, it will be me. Yeah, so I will do that. We also have, it's called Doppler Ultrasound. It's a technique we use now to kind of look at the rate that the blood's moving through the heart. It's really, really great. It can tell us a lot about how your heart's working. So if you take that until I see you the ultrasound, that should hopefully help with you feeling like lying awake with your pulse and stuff like that. So that should definitely help. And what we'll do is, after that, we'll have a further consultation, and we'll determine whether or not we'll change those drugs, because by then we should hopefully know what the actual issue is and be able to treat that. Yes, there is the option that you may have to get surgery. Some of the techniques are not that invasive, so what that means is that it's not like open heart surgery. If, for example, you need a stent put in, it's not as invasive as some other kind of heart techniques yet. So if it's the muscle, we'll probably alter your medication. We should be able to treat it without surgery. If it is a blockage, we probably will need to go in. Yeah, so that's why I would maybe also kind of lower the products that have cholesterol in them. I would like butter, for example. So you've been told that obviously before, that's why you're on the tablets, but I would really try and reduce all those kind of foods with cholesterol in them. Absolutely, just to give you the best chance. And if it is a blockage, we don't want to make it any worse. Yeah, and salt on your food, nah. Yeah, you get enough salt in your food, don't add any extra on, because that can also be a reason why there's a blockage. Absolutely. Okay, well, I hope this has been an informative session for you. I don't think you should go and worry about it. We've given you the tablets and you should be able to kind of relax now, and we'll just work out what's wrong at your ultrasound. Yep, so try not to worry in between now and your ultrasound. Okay, if you do continue to have the chest pains and they get even more severe, just give me a phone call. Yep, or if they are really severe, then I would go and see your GP so they can make a referral straight away. Absolutely. Yeah, if you feel like you're having a heart attack, I would call 999, but I don't think that's going to be the case today. Okay, well, thank you very much. Pleasure to meet you. Okay, take care. Bye now.